I'm Dr. Gabriele Miotto. I'm a plastic surgeon in Atlanta, Georgia, and I'm going to talk to you about liposuction. Liposuction is a very popular procedure designed to improve fatty deposits in all areas of the body with tiny little incisions, so tiny little holes that are created of about 2, 3, 4 millimeters only. And then using a cannula or a special device, we go into the fatty deposits and remove that fat. It's ideal for patients that are in a good body weight, but have that fat that doesn't go away with diet and exercise. So it was designed to be a shaping procedure. In my opinion, it's not a good procedure to help patients lose weight. So I always recommend that my patients are in a good stable way to go under liposuction, because it can create irregularities or excess laxity if the patients gain or lose weight after the procedure. Another misconception of liposuction is that it can tighten the skin. There are so many devices in the market that claim that liposuction using those devices will really tighten the skin, but I've seen over the years that a good liposuction done with multiple cannulas in multiple levels of the area can also tighten the skin, but there is always a limit. If the patient has skin laxity, the liposuction is not going to tighten that skin laxity, because as you imagine, the skin is stretched out with the excess fat. When we remove the fat, that skin needs to go down and retract. If there is always laxity before the procedure, that laxity will be actually increased after the procedure. So that's why sometimes, for example, for the stomach, is not only liposuction, we need to add a abdominoplasty, a tummy tuck, to remove the excess skin. And that is true for other areas of the body. Sometimes we can do a liposuction and see how much that skin retracts, but if it doesn't retract as much as the patient wants, sometimes we need to go back and do a excisional procedure, such as a tummy tuck. But a liposuction is an amazing procedure because it has basically no scars. The recovery is really fast, about a week or so. People are going back to exercising and their routines. And of course, it depends on every single patient. We are all different, but most patients have some bruising for about 2 weeks. The swelling stays on and off up to 3-4 months. And then we also can emphasize the muscles with liposuction, which is the high definition or the medium definition liposuction. So if the patient has good muscles, and that's the importance of being in a good weight, exercising, liposuction, when the muscle structure is nice and firm and developed, can give an amazing result afterwards because it makes the muscles show. So the liposuction can also be a way of removing fat to prepare this fat and do fat grafting in other areas. So we always use a little bit of liposuction to do fat grafting. We take the fat out, we prepare it as a filler, and we can inject in the face, usually in the breast and in the buttocks. Those are the 3 most common areas, but also the hands are also a nice place to use that fat. Instead of throwing that away, we use that fat for a good purpose to improve the efficiency of volume in other areas of the body. So if you want to know if you're a good candidate for liposuction, if you're thinking about that, please come to the office. Let's examine you, make a nice plan for you, and then have the procedure done. If it's a small area, it can be done under local anesthesia, awake, but usually larger areas require general anesthesia or a deep sedation. I'm looking forward to seeing you.